All right, so it is 1:30. We're going to go ahead and get started. Welcome everyone to the school year 2022-2023 COVID-19 School Health Support Grant Cycle 3 webinar. This is our launch webinar. This is a program overview in the eGrants application training. My name is Damon Hoyle. I'm the Senior Operations Project Manager here at TEA, and one of my major responsibilities is working with COVID and all things COVID when it comes to our grants and different things of that nature. I'm joined today by a few of my colleagues from our grants and division department who are experts in grants. I'm more on the programmatic side. So I'll let each of them introduce themselves. We can start with Amy. Yep.
Yes, I'm Amy Samet. I am a grant negotiation supervisor, and I can help you with negotiation related items.
I'm Susan Alexander Wilson. I'm also a grant negotiation supervisor and serve the same role as Amy.
Great, thank you, Susan.
Good afternoon, my name is Nick Davis. I'm the interim chief of staff in the Department of Grant Compliance and Administration.
Good afternoon, Matt Lashley, interim director of special monitoring division here for program support for the school health support grant.
Let me take myself off of mute. There we go. Wonderful. Okay, so we're going to go ahead and move forward. So here, the next two slides are just some disclaimers. I'm going to let you all review those really quickly. It's just standard disclaimers that we put before at the top of all of our webinars, and then we'll get into the crux of today's training or webinar. So this disclaimer is pretty much just saying that things are subject to change, but as of today, as of September 14th, the content of this presentation is what we know to be true in terms of the CDC grant guidance. Second and last disclaimer page. This final one here is just saying that we're not necessarily the authors of the content. We're just reflecting the CDC. We've taken the grant and made it applicable to public and private schools throughout the state of Texas, but the grant is in compliance with the CDC guidance and grant guidelines, rather. All right, so today's agenda, we're going to start off with some session norms and reminders. Then we're going to move on to the background and some cycle distinction. We know that there was a bit of confusion. We take responsibility for that, so we're going to take some time to clear up cycle 1, 2, and 3 of the school health support grant. Then we're going to talk about funding and allocations, allowable activities. We'll get into the actual eGrants preview of the application and that process, reporting and compliance monitoring. We'll end off with some resources that we'll share where you all can go. And then we'll have a Q&A session at the end of today's session. One of the things that Nick, Amy, Matt, and Susan will be doing as I present, or as different folks present, they will go ahead and be answering questions in the Q&A feature. I see we have a raised hand, so let me throw out some norms and reminders first. So the scope of today's webinar is for the school health support grant. We know there's many things going on with COVID and other things. This is for the school health support grant, not the K-12 COVID-19 testing program. This is for cycle 3. So this is specifically for folks who've never applied for the school health support grant, and I'll break that down in a second, but just wanted to make sure we stay within the scope of that, and that questions and comments, since we only have an hour, are within the scope of that. We have a Q&A feature to ask questions. Please monitor that as we go along to see if your question has already been asked. Our panelists from TEA will respond throughout the session. If you can, we'll take questions at the end, but if you ask questions throughout, they'll answer them, and then at the end, we have some time allocated to take Q&A session. For a Q&A session. If you need to, raise your hand, and then we'll call on you to unmute, but what we do want to do is we want to reserve them for certain times of the session, unless it's a very pressing question, because we want to make sure that we use our hour efficiently. And then lastly, this webinar is being recorded, and it will be posted on our COVID-19 testing website, which is on the TEA website, and we'll also post a slide deck, a PDF copy of it. So you'll get the webinar recording, and you'll also get the PDF copy of this. So anyone that missed it, they can go back and review it, and if you all want to go back and review it, you can as well. What I'm going to do now is, because I don't like looking at myself, I'm going to take myself off of camera and then we're going to move forward. All right, so background and cycle distinction. Federal dollars to support schools. So in 2021, last year, around May, June, it was like the end of the spring, but in 2021, the US Department of Health and Human Services invested $10 billion from the American Rescue Plan to states to enable schools to establish COVID-19 screening testing program, primarily for screening testing, to support and maintain in-person learning to slow down the spread of COVID. So let's provide resources to schools so that we can get schools back open, because we know that kids learn best on campuses and when they're with the teachers in person. And we want to, so let's slow down the spread by providing them mitigation resources and opportunities. Texas, out of that 10 billion, Texas received about $803 million because we're a large state and have a huge student population. Those dollars flow through our state health department to administer, which is the Texas Department of State Health Services here in Texas, also known as DSHS. Within that $803 million that DSHS received to work with TEA, we took $221 million out of that grant to allocate to eligible public and private school systems so that they could apply for additional services and resources. So that can be PPE, HEPA filters, CLIA waivers. We'll get into those allowables. So that's $221 million was set aside just for the school health support grant for you to have access to pull down funds within the allowables for all those that are eligible. DSHS and TEA came together to collaborate. They work with the CDC. We know schools, we came together to make this an accessible grant for school systems, public and private, across the state. Now, let's go even further. Well, let me back up. Let me clarify something. We do know that the CDC has released guidance over the last 4 or 5 weeks around screening testing not being mandated. That is very true. We have not updated our guidance yet because the CDC grant guidance itself has not been updated. And we have been instructed by DSHS that we have to follow what the current grant guidance is. We're expecting it to be updated to remove the screening testing piece. Once that is done within the next, we were told very soon, we will update all relevant documents and communicate that to you. But as of right now, we're in grant compliance because the former grant is still what's on the books. So I just want to put that out there. All right, so to go a little bit further, 803 million broken into 2 parts. The one part that many of you are familiar with that we're not getting into today other than this is the K-12 COVID-19 testing program. That is to provide school-based COVID-19 testing activities through the work of 6 approved vendors to provide eligible public and private school systems with access to rapid antigen and PCR COVID tests. So they work with those vendors, they get the test, they test their students. They can also have staffing support that comes on their campuses and administers those tests. But that is the K-12 COVID-19 testing program. That's what the other remaining of the 803 million, it went towards that. The 221 million that we've talked about is what we're talking about today, which is access to these funds, direct funds that you get. Because through the K-12 COVID-19 testing program, you don't actually see the funds. It just works through DSHS. You have an account and we allocate it. But for this grant, you get the direct funds that you can use. So that's the difference there. So I'll move forward. And all of this is on our website if you want more detail on the K-12 COVID-19 testing program. All right, cycles. So TEA has been asked to implement over the last 3 or 4 months. We've been given a charge to implement enhanced monitoring and reporting for the duration of this grant, which will end March 2023 in terms of next year. And then we have to finish all our reporting by the summer. But we have to implement enhanced monitoring and reporting, which necessitates changes to previous grant processes and applications. So because of that, we had to develop these cycles. Now, we know many of you are familiar with cycles via ESSER grant. That's a little different here. The term cycle 3 might be a bit confusing, but it does not indicate new funding. It's the same 221 that was originally allocated. It is just the extension of the school health support grant from last school year to this school year for specific LEAs that did not apply. So the grant originally came out in the summer of 2021, was only going to run a year. They extended it for an additional year. And so what we've done is extend the grant, and any funding that was left over is available for those school systems that are eligible but did not apply. So let's go further. Cycle 1. These are LEAs that applied, received the NOGA, and were already fully paid last year. That means you were fully paid, you got all your funding. That's cycle 1 out of the 221. Cycle 2, these are LEAs and private schools that applied last school year. They received the NOGA, but were not paid last school year. This cycle also includes private schools that had not previously applied. So private schools are not going to do this eGrants piece. They're going to all do a PDF thing. They're just a little separate. But cycle 2, if you applied last year, you got a NOGA, but were not paid, you're cycle 2. And then cycle 3 is who we're really dealing with today. These are LEAs that never applied last school year, but now can apply through the eGrants. And then that's who appears when I click here on this entitlements page. That's who appears. So when you go to our entitlements page and you see 222, 223 COVID school health support grant cycle 3, the LEAs you're going to see there are folks who never applied last year. So folks were wondering, well, why is my name not on there? Why is my school not on there? Because you applied last year. You're still on this allocation, which is all the schools. All we did was remove the schools that did not apply last year, and they were added to cycle 3. So let me get a little bit more granular. At the bottom, there is no new or increased funding for this grant. So there was not an additional, we got more money. No. It's 221 that's divided amongst all of you. The entitlements and allocation amounts have not changed at this time. It's just a list that was parsed out specifically for those that did not apply. So it's the same grant. Let me go a little bit further. Cycle 1 process. If you are a cycle 1 school district and you happen to still be on this webinar, your school systems, once again, that received your NOGA and you were fully paid during last school year. Here's what you're going to be doing, because it's you fall into 2 groups. These are LEAs that did not expend all of their funds. So you got paid last year, but you have some money left over that you didn't spend. That's great. You have to March of next year, 2023, to spend the funds. The remaining funds can be used throughout the duration of this grant, including a new allowable, which is wraparound services. Wraparound services were added this year with the extension of the grant to help with kids who tested positive for COVID. We'll get into that. Also, cycle 1, you might be a school district who was paid and you expended all of your funds. That's okay. You can reclassify your expenditures or amend this grant through this amendment link. So if you were already paid and you expended all of your funding, you can go through this link and amend it and move some money around because you have a new vision of what you want to do with the COVID funds, or you want to allocate some funds towards wraparound services, which was not an allowable last year. You can do that. So that's cycle 1. Those who were fully paid, who can reclassify funds, if they expended all of it, those who were fully paid but have some money left over. You will find out more information. We're going to do a whole separate thing for you by or before Monday, September 26th. You're going to receive an email. You're going to receive additional support from us for cycle 1. So just wanted to let you know. Cycle 2, folks, these are LEAs and all private schools that applied, received a NOGA, but were not paid. So you applied last year, but you didn't get your funds yet. We understand. So for you all, you're going to be switched over to a PDF grant application process, which is pretty traditional here at TEA. In that PDF grant application, it's going to be posted on our grants opportunities page. The same one here, it'll say School Health Support Grant Cycle 2, because you fall into category Cycle 2. It'll say that. When are you going to find out about it? Tomorrow. By end of day, you're going to get an email just to those folks that received the NOGA last year, applied last year, but were not paid. You're going to get an email from our grants department, from us, and it's going to have the application process steps. It's going to have an FAQ, and you're going to have a separate webinar just for Cycle 2 folks next Wednesday, September 21st, 2 to 3 o'clock. That webinar information will be included in the communication we send tomorrow. So cycle 2, folks, hold tight. More information will come to you tomorrow, close of business. You'll have a webinar next week. Cycle 1, folks, we're going to offer you some office hours and communicate that to you by September 26th, if not before. So wanted to take some time to break out who cycle 1, cycle 2 is, because the rest of this presentation is pretty much only applicable for the most part for cycle 3 people who've never applied. Moving forward, cycle 3. These are folks who never applied. I already talked about that. You're here, you're attending today's webinar. Go back once we post the webinar, review it, look at the slide deck, visit our grants opportunity page. I'm going to go there now. If you go to our grants opportunity page, if you just click down on here and you scroll one time under COVID, I looked at this earlier. Let me see if, no, sorry, here we go. 2022, 2023, there it is. 2022, 2023, cycle 3, it pops up all the information you need if you're cycle 3, folks that never applied. All your information is there to apply, all the dates, and we'll get into that. So that's for you. This is happening today for you. This is our support for you today to help make sure you understand what you're getting into if you choose to apply. Last notice, City of Houston schools. So the City of Houston received $69 million throughout the same $10 billion that the federal government gave out, and Texas got 803. Well, the City of Houston got its own pot of money around the tune of $69 million. I'll click here so that you all can see the resources. If you go here, this is what each state received. If I go further down, Houston and a couple of other cities got separate funds. Because Houston got that $69 million, they're not eligible to receive funding for this grant through TEA. They have to go through the Houston Health Department. So who are those schools? It's also on our website. I'm going to click here really quickly. It'll pull up an Excel document. Let me pull it over. Hopefully it'll let me make it bigger. There we go. Any school listed here, you are covered by the Houston Health Department. That's who you will go through for these funds. And what we've offered for you is if you click here, this is also on our website, there's information of who at the Houston Health Department, if you fall on that list, for who you can reach out to for more information for your mitigation COVID additional funds. So that's where that is. All right, moving forward. Now let's get into it. Funding and allocations. So now that we've gotten the cycles together and parsed out and who falls where, we're now going to be dealing with specifically cycle 3 folks who never applied, who are going to apply through eGrants for the school health support grant. So how did we come up with the formula for your funding allocation? The school health support grant was calculated with a per pupil formula of $38.57 per student based on the 2020 PEIMS data. 2020 PEIMS data, because that's what was decided. Now, if you're wondering how we got to $38.57, I wasn't going to say this, but let me offer it in transparency. There was $221,800,000 for this part of the grant. When you take about 4.5 million kids in public schools and you add the additional 300,000 for private, you come out to about 5.75 million kids that are eligible for this grant. You divide that 221 by that 5.75 million, you come out to $38.57 per pupil. So that's how we did it to make it equitable. That's how we got the formula. With that said, school health support grant cycle 3 school systems, you already know this, your allocations, I've already gone to this, are on this page. You go to school health support grant cycle 3 by LEA, and it's listed for you at that $38.57 calculation per pupil. You can also look at it by ESC region. All right, moving forward. Now I'm going to switch this over to my colleague, Matt, throwing him I'm going to turn this over to Matt Lashley, and he's going to now talk about the allowable activities and what's allowable throughout this grant.
Susan, can I get a thumbs up? Can you hear me?
Yep.
All right. Thank you, Damon. So
For our allowable activities and overview, these slides are, again, guidance. Whatever cycle you are a part of or whatever questions you have, I want to urge you to always look at the program guidelines for that specific grant. Again, slides and presentation are to kind of help prepare you, but these slides are not the allowable activities. This is just a representation for planning purposes. So always have your specific set of program guidelines for your grant, which in this case, if you are in cycle 3, would be the posted grant guidelines on the TA grant opportunities page. Any changes to allowable activities or official guidance change through the grant guidelines, not through slides. So that's why I have that disclaimer at the beginning. So I just want to urge you to not hedge all of your bets on slides, especially as this grant moves forward. We don't anticipate changes, but we're just talking through allowables in a slide. The program guidelines are your official documentation along with FAQs, answers, and any other errata or guidance. All of that information that is a part of cycle 3 is developed and managed in partnership with our team that includes Amy and Susan in grants. So for cycle 3 schools, for those that have worked with TEA grants or funds before, generally you would expect this to look like any other grant application. There are differences, but you will expect a similar process to other TEA grants. So in the allowable activities section of the program guidelines and noted in the application, which we will touch on a little bit later, there are 8 allowable activities. I want to point out, again, this has changed since last year. So if you reviewed the grant last year and didn't apply, if you're still on this call and you were cycle 1 or cycle 2, again, focus on the allowable activities in the program guidelines that you have or will receive for your grant. Just going to point out these allowable activities and for this grant are very specific. We always like to say with this grant, do not treat this grant in terms of allowability as you would your ESSER grants. You do not assume flexibility in this grant. That's not because we don't want you to best serve your students, but this grant is from a different federal funder, which is the federal CDC, and has additional requirements and restrictions on allowable activities from our state partners at Texas DSHS. That is not by accident, that is by design. So these allowable activities are quite stringent. If you ask questions about what is and is not allowable, we will do our best to answer those through FAQs, but you do not want to, in your planning or in your own mind, expand what these allowable activities might be. And I certainly wouldn't recommend you go outside of these specific allowables without clear guidance or approval from TEA if you have an activity you think might be allowable. Again, assume stringent, assume specific, and assume literal with these allowable activities because this grant comes with additional requirements and it's from different federal and pass-through funders at the state level. So PPE, this hasn't changed. Again, this is a COVID-based grant, so PPE, including but not limited to masks, gloves, gowns, and face shields is allowable as it was for past cycles. Hygiene and cleaning supplies, again, read supplies, not equipment. If you are considering cleaning equipment, that is not expressly allowable in this grant. So these are supplies which the connotation is that they're consumable and you would follow your same federal guidance on supplies versus equipment. So cleaning equipment is not allowable under number 2. Hygiene and cleaning supplies are. Cleaning services are not allowable under item 2. Hygiene and cleaning supplies are. Staffing for this is not allowable under number 2. Supplies are. Number 3, portable high efficiency particulate HEPA fan filtration or other small items that may allow for improved air circulation. This one, there has been some room, and we've learned in the first year of this grant that you want to focus on portable and small. Typically, equipment, again, has been questioned and not allowed in this grant. If it's not truly portable and not for air, fan, or filtration systems, it's not allowable. This is the one that excludes HVAC, capital projects, equipment of that nature, small and portable. We'll talk a little bit more about what that does not include a little bit later. Number 4, this is one of the allowable items that having enough time to actually operate is very helpful. So we're grateful for this extension in these funds, but you can plan public health events that include students and other community members aimed at providing opportunities for increased detection and prevention of COVID. Testing events that may also involve mitigation activities, which is promotion of vaccine to limit the spread. keep in mind, there's no testing activity in 4 or 5 allowable. These are testing events that may involve other mitigation activities. So that's a big change from year 1, that the actual testing services from other outside vendors is not an allowable any longer. We still allow the cost for a CLIA waiver, which is a pretty nominal fee, I believe, but is one that school districts had said would be helpful to have, and that's another allowable activity. Number 7 is unchanged from last year's guidance, but is still one that we want to parse out a little bit. Partial funding for staff conducting additional grant-related activities outside their normal activities is allowable, including some screening tested COVID prevention or grant reporting. A couple of caveats here that will be addressed in the FAQ that we want to point out that might be quite different from what you've seen when you operate TEA or manage TEA grants with federal funding. But this grant does not allow stipends. That is very specific in the FAQ guidance. That can make this difficult. You cannot, I'm going to use the term supplant existing staff funding that was not a part of this grant. Partial staff funding for staff conducting grant-related duties generally means staff in number 7 you're going to cover with this grant should be covering one of those other allowable duties. So again, if it's not clearly in these allowables, we're going to urge you to submit an FAQ. If it's not addressed, we're going to try to manage those through a larger question set. But this staffing looks very different with a CDC grant than a USDE grant. So when you're planning for this and for staffing, they have to be grant-related duties. It can't be something that was going on before this grant. If you're new, it's got to tie to the allowable activities of the grant. And general staffing for other COVID duties that's not expressly documented, planned for, and a part of this grant could likely put you in a place where you're going to have to prove through documentation that you're in compliance with that. That is a very different allowable activity in staffing than you might be accustomed to with ESSER. It's not nearly as broad or flexible. So we just urge some caution there if you're planning for staffing. The new allowable activity, which we are also very grateful for that our partners at Dishes had reviewed and we had advocated for, is wraparound businesses. Wraparound, at least in this case, includes things like food, laundry, mental health services within what's allowed at the federal level, but it's for those who test positive. So wraparound is a quite inclusive phrase, but you want to pay attention to the allowable activity and ensure your intent aligns to that allowable activity as it is stated in the guidelines. If you want to see where there is flexibility, you can, again, we'll have a process to handle your FAQs and to get guidance. We will always check this allowable activity question with our funders at Texas DSHS. So any questions that we haven't received before or that are new, we're going to do our best to get responses for you, but we need you to understand that we're not going to give you an unqualified yes if it places you in a state where you might be at risk. So we will check, especially with these new allowables, to get more and more clarification through questions with our partners at DSHS so that you're in the your posture for your compliance posture is the best it can be. We always want to put you in a place of yes with all of the documentation and guidance you need to be effective and not have to review use of funds later and potentially send any funds back. So there's a link in this to the grant guidance. I will let you know as you submit FAQs on allowable activities. The best place to send those questions is COVID case report. Allowable uses of funds questions aren't typically handled by our grant staff negotiating. They will share those with us, but you're likely to get a better and faster answer on what may or may not be allowable that needs a determination if you email COVID case report on that question. A grant negotiator that gets an application and then receives the question is going to go through all of the regular compliance checks. They're going to check with Amy or Susan or other staff or supervisors they work with and check our guidance. So if you need answers before you apply on a specific allowable, send it to COVID case report if you have an idea of an activity that that you don't see literally word for word in this, but you want to ask. You can go to the next slide, Damon, unless you have anything to add or anyone else does.
No, we're good to go to the next one.
So we've been a little more explicit in this year now with what's unallowable. We've learned from some requests and from some enhanced monitoring what is outside the bounds of what's allowable with this grant. So you'll see most of this stated in the grant guidelines and not allowed in the application, but want to call it out clearly. Some of our standard unallawables: debt service or lease purchase here, advisory councils, major renovation or construction is not allowed. Again, this is not USD ESSER funded. This is a different fund source. No major renovation or construction, no tuition reimbursement, out-of-state travel. New to this list that was allowed in the past was COVID testing, test kits, turnkey services, and related support services. So that's different for cycle 1 and cycle 2. So for cycle 3, that is not allowable under this grant. And then I think we just have a repeat of a few in there, but those are standard debt service, advisory, yep, tuition and out-of-state travel. So just because it's not on this list does not mean it's allowable. Again, if you don't see it and you need to ask as you're planning your application for allowable activities, you reach out to COVID case report, and we're going to be standing up a new FAQ system similar to our ESSER grant structure, where you'll have a full database of questions and answers so we can serve all of you more expeditiously with these questions. Other unallowable activities, we've seen HVAC systems. We've still had LEAs request this. HVAC systems are not allowable under this grant. I mentioned cleaning equipment or contracted services. Purchasing technology to support testing is not allowable. Though helpful, not allowable for water filtration. Those small items are for air quality. Health supplies used in events, though it allows for an event, Band-Aids or other general medical related supplies are not allowable. Hosting conferences, membership to any civic or community organizations, travel costs, stipends for non-employees, field trips, and then other types of conference costs are not allowable. I don't know if we had any other. We'll go in after.
No, that's the last one. That's the last.
Yeah.
Yep.
So we'll go on to the next slide, whoever's next, and we'll keep our eyes peeled in the Q&A for allowable use of funds questions. Thank you.
Got it. Thank you, Matt. I'm going to turn it over now to Nick, who's gonna we're gonna now jump into the actual eGrants process, application process.
Yeah, thanks, Damon. So you'll find this application currently listed on TEA's grant opportunities page. You're going to see all of your pretty normal standard grant related things here. Damon, you can go ahead and click on that. So you'll go to the grant opportunities, and you'll be able to find this particular sample application, which again you'll apply through eGrants here. But if you'll scroll down, Damon, to kind of looking at actually the budget and putting in the allowable uses that your district would like to request with this grant. Yeah, you can stop right there, Damon. So all 8 of the allowable activities are listed on the application here, and they include 2 components. So there's pre-award, which goes back to May the 1st of 2021 to the date your application is submitted to the agency. And then you have grant costs, which is from your submission date of the grant application to 31st of 2023. So you'll see that you'll have a section for PPE that's pre-award, and it goes through all of the months from May of 2021 to the day that you could have applied for the grant. And then you're going to have grant costs, which are, again, month by month breakdown of actual grant costs that you're going to incur from the day you submit the application to March 31st of 2023. And go back to the slide deck here, but you see that there's a lot of different months here. It's really pretty lengthy because we have every month broken up here by pre-award. And then once we get past pre-award, you're going to see that we've got PPE again, and here's grant costs. Be really cognizant here. Do not put dollar symbols here. Just put straight whole numbers for your district. And if there's no planned cost for that particular month, then you're going to put a 0 in that particular section. It gets really lengthy, but all 8 of them are broken down in the exact same way throughout this sample application. So it's about 60 pages of a lot of stuff, plus your assurances and whatnot. And that should be it there. Pretty standard stuff generally. And again, this will be done through eGrants like we typically do here at the agency. But this is just a sample for your planning purposes for your district to take a look at before you kind of get to the eGrant system and put it in on behalf of your district.
You good to go back to the slide deck?
Yeah, go ahead. Yeah.
Okay. All All right,
Yeah.
go to our next slide.
Yeah, so I've kind of covered this, but pre-award again is back to May 1st of 2021 to the day that your district applies for this particular grant. The end of the grant is March 31st of next year. The application due date for this is November 7th of this year. The last amendment due date for this grant is January 3rd of 2023. Again, this is a federal grant. We've got some questions about administrative costs, which is no more than 5% of your total grant award that your district receives. And then indirect admin is equal to your current district approved indirect cost rate for this particular grant.
Got it. All right.
Yeah, next we'll talk about kind of reporting and compliance monitoring here. So there's a couple of things here in terms of reporting requirements. So we'll start first with monthly reports, which are generally financial and expenditure data. These are done via Smartsheet. We do them every month and report them to Texas DSHS, DSHS. So the link and the instructions are sent out roughly by the 15th of every month. Schools will have about 2 weeks to complete this particular report. If the deadline's missed for any reason, your school will need to submit that information on the following monthly expenditure report. So you just kind of tack it on to the next monthly expenditure report. We've updated a couple of things with the report in terms of if you have no expenditures for this particular reporting cycle, then you would just indicate that up front so we don't kind of waste your time having to put zeros in the entire form for us. You'll just kind of be done and you'll get a confirmation like you have no expenditures, and you'll assure to the agency that you did have no expenditures during the grant period or during the reporting period, excuse me. And then we have annual progress reports or APRs or any final reports with this particular grant. These may later be required, and there may be some data requested from districts regarding these annual progress reports as they become available, or if we're asked to provide any particular data to Texas DSHS in regards to uses of this particular grant. And then the last one here is we've had some enhanced monitoring from Texas DSHS in regards to really looking at allowable uses of funds for districts and how they're justifying and how they're keeping that documentation locally. And so, school systems that are recipients of both the school health support grant, you're required to thoroughly track all of your expenditures and keep a record of other applicable documents. So this is pretty standard that, it's very, very highly recommended that a district document, and justify their particular expenditure in light of the 8 allowables. As Matt touched on earlier, the allowables are not like ESSER. It's not super flexible where justification can sway you one way or the other when it comes to us taking a look at allowable uses. These are pretty specific allowable uses, and they're very limited in scope. And so we want you to be very cognizant of that in the event that we have another kind of enhanced monitoring report that has some findings regarding districts that we're going to have to kind of look at and determine ultimate allowability. What that typically requires is that we're going to ask for documentation. This can be payroll if there's extra duty pay for folks doing kind of grant related duties after their normal work hours. So we could request stuff like payroll, but we could also ask for descriptions, pictures, things of that caliber that show, things like your portable air purification. Is it really portable? And we've got some questions about that. And so we're really requesting that you keep that documentation on hand as it may be requested at some particular point if, through the course of enhanced monitoring with Texas DSHS, that they want us to look at particular districts and they're kind of questioning an allowable use of funds that was reported by your particular district. And so we're trying to get y'all ahead of that to keep very good documentation on this grant and to know that the flexibility that you have with other kind of pandemic related funding such as ESSER isn't really super applicable here because this is a very constrained list of allowable uses. And with enhanced monitoring, there's kind of been a push to take a look at more of these allowable uses and kind of, be a little bit more kind of scrutinize these a little bit more and make sure that they are in line with the intent and the compliance pieces of this particular grant.
Great. Thank you so much, Nick, for that. We're going to move forward to resources, and then I think we're going to have a good chunk amount of time probably a little less than 20 minutes to answer any live Q&A. And then, like they already said, we have the FAQ piece that we'll have as well. So resources. So accessing resources and contact information. So a couple of things. Here's a link to the School Health Support Grant Cycle 3 grants webpage. That's once again, this page, you literally go there, click. If you just scroll down maybe once or twice, you'll begin to see where the grant is listed, which is right 2022, 2024. I was doing this so well beforehand. It's right in here. Thought I just saw it. And this is why it's okay. There it is. Sorry. You just swipe twice. There you go. Right there. You can also search by keyword too. Sorry. If you just want to search, you can also type in keywords and it'll pop up for you. So with that said, it's right there. We also have our K through 12 page here, which is where you will see a lot of our information posted for all of our public health, our K through 12 COVID testing program. And so within the next 1 to 2 business days, this slide deck that you all see will be posted right under here under COVID-19 School Health Support Grant. You're also going to see a recording posted here as well, and then all of the allocations. So you'll see a lot of the documents in 2 places, on the grants website and on this website. So just check out both, but that resource is there for you. We really do encourage you to check out the website because we do offer and provide a lot of information that we typically update weekly, if not every other week. And so, you can always email or reach out, but sometimes a lot of the information is already provided. Now, you just want to email or you need further clarification, no problem, reach out, we'll get back to you. With that said, there are 2 email addresses that were touched on earlier. There's the COVID case, and this is not correct. There's COVID case report. Let me actually fix that. So I'm going to type it in the Q&A feature for you. It is the COVID case. Actually, I'll just fix it live and I'll come back to it. But it's COVID case report at tea.texas.gov. And then there's grants at tea.texas.gov. So those are your 2 email addresses that you can reach out to if you have questions or concerns or need additional support that you couldn't find on our website, or it's just something very particular. So those are the resources we have for you. With that said, I'm going to open it up for Q&A. Before we get started, I'm going to stop share because I want to fix something. Nothing like fixing it live. And then we can go ahead and start looking at some questions that we have. So I'm going to go ahead and open it up. We had a question. This is for anyone on our grants team or for me. It says under cycle 1, this is from Laura Ham. Our district was entitled to $1.7 million roughly. However, due to the original timing requirements, we only applied and received by $923,000. Our district is not listed on cycle 3 entitlements list. Can we still apply for the remaining? So I'm going to answer this, and then Matt or anyone else can jump in. So you're still in cycle 1. You still have access to those funds. So you don't have to reapply. Your cycle 1, you're still in the Qualtrics piece. So you can still draw down that money to spend the remaining funds, or you can go back and reclassify what you've already spent. So that money is still yours. You don't have to reapply for anything. Matt, did you want to jump in and add any clarifying pieces there? They don't have to go into cycle 3 to apply in eGrants.
That's correct.
It's
If you're cycle 1, you're still cycle 1. The issue here, though, is 2-part. If you applied for less than you were allowed to apply for in cycle 1 for any number of reasons, I think Laura's asking if they're still entitled to the remaining funds. We've had to separate funds for cycles. We have not changed allocation, so we don't have further guidance yet for schools that were no good and received less funds. But we did not reallocate those. We did not take them away. So we will have further guidance for cycle 1, but you will anticipate a Qualtrics type system to apply for additional funds with a revised no-go and a dollar amount. But we still have to work through some details for cycle 1 because that group that has been paid, you do not have grants in the ER, the standard ER system. You will not be included in cycle 3 right now. So we just ask for a little bit of patience because we have to go back to those amounts, and that's handled in cycle 1. So again, we have not made any moves or changes with your entitled funds. We know you decided based off a 1 year, short of a 1 year timeline. So we will include further guidance on that cycle 1 when we give more instruction on that. But it's likely going to be a Qualtrics style application, with revised NOGA and potentially a supplemental payment to you. But you'll have some other changes in cycle one to consider, like the wraparound services, some revised reporting, because a few other items have changed with cycle one. So good question, Laura. Encourage you to send any of these questions to COVID case report, because we will be putting questions and answers for all cycles into one master FAQ. So if you need written guidance or your district leadership would like to see it posted, send those as grant questions to COVID case report so we can batch them and get posted responses to all of them for you as we move forward. Thank you.
Perfect. All right, we'll go back in. Dana Smith, hi Matt, for a grant application to be accepted, do we have to have a planned process for testing COVID, staff, students, and community? So this is an interesting question. I'm going to jump in here, Matt. You can if you want to. So part of the grant says that you do have to be conducting some type of screening testing. What the CDC is about to release within the next week or two, we're estimating, is the removal of the screening testing program. So as long as you have some type of COVID testing going on, then you should be fine. But for Dana Smith, we're waiting on the new grant guidance to be released. So just hold off, because within the next week or two, we should be able to give you updated guidance. And so right now, we don't want to give you, right now it says you have to be doing screening testing, but that's about to be removed. We're just waiting on them to update the grant guidance. That's pretty much the best answer I can give right now as we wait on that. Nick or Matt, did you want to jump in, or anyone else want to jump in and clarify that question or add to it?
I would just add for folks that that are in cycle 3, the guidelines have specific requirements at the statutory and state level, where this grant does, if you're in the vendor testing program, your compliance in that program can affect your compliance in this grant, right, Damon? So we'll have FAQs to answer that, but if you are in the vendor testing program and you have this grant, if you ever get into reporting compliance issues in vendor testing, it can affect your receipt of grant funds. Those are all linked. It was an earlier slide Damon had shown about the total funding for the state. So there are other reporting requirements that are not about grant funds if you do the vendor testing program that can have a negative impact on your grant compliance if you're not doing that as well. So it's still 2 funding pots and 2 worlds, but they are related. So you can post any of these questions again to COVID case report, but if you're not compliant in the vendor testing report, we'll likely be asking further questions because you have to be compliant in both if you're in vendor testing and the grant.
Perfect. Thank you, sir. Next one says, if a district received the school health support grant and did not use but $300, does the district need to give back, or will the district automatically receive allocation for cycle 3 and can add to the amount along with the new entitlement? Nick, you
Yeah, so I'll unpack this one. So kind of first things first, I'll work backwards. So you won't have to apply for a new entitlement. There won't be another application. So you're likely a cycle 1 LEA that had received an allocation and already applied through the Qualtrics system. And so it's the same kind of similar question. We'll have to circle back on if you've spent only a portion of your entire entitlement that your district received. If you can continue to do that, we'll, like Matt had mentioned, will likely be kind of in a Qualtrics-like system again, but we'll kind of circle back once we have some clarity on kind of the next steps for those folks that are in that particular situation for cycle 1.
Got it. Thank you, sir. Since COVID, we have, and this is from Sarah Mathis, since COVID, we have partnered with our local hospital system to provide a nurse each. So you're typing that one, Matt, each campus. Can we utilize some funding from this grant to offset? I guess that one was already answered, but go ahead, Matt.
No, and I was going to do it verbally too. The issue if you're in cycle 3 with hiring and it's got to be grant related is you, first I'm going to urge you to send with detail some information, including the role and the hiring date. What happens with a grant of this nature is at the time the grant is posted and you have an allocation and you decide to apply, could have bearing on whether or not that's allowable, because it has to be partial funding for staff related to grant activities. So an example of it being unallowable would be if you were going to hire these nurses regardless, and they're not doing any of the activities in this grant, that may not be allowable. If they were hired and paid full-time, that's potentially allowable depending on hiring date. The point of this is it's got to be supplemental and tied to this grant. So if the intent was we hired nurses, early in ESSER days, and then this grant came along, that may not be allowable. It's got to be tied to these activities. And it's just a very difficult one without getting more specifics on hiring. So generally it could be, but ultimately if it's going to rely on the LEA maintaining the justification for the use of funds. So if you need further guidance on those, you would send it to COVID case report, include as much detail of their activities and what they do and their hiring dates. Again, these are the types of questions we will take directly to our state funders to make sure we have really clear guidance for you before you formulate a plan for staffing that ultimately wouldn't be allowable.
Thank you, sir. From Liz Oaks, it says, on the cleaning supplies as an allowable use, are there any requirements on those cleaning supplies? Let's say we have bought those cleaning supplies before with local funds.
Yeah, this would be an allowable use of funds here for cleaning supplies.
It will go back to the pre-award date on the specific grant again and how much you could reclassify if you did, but that would be allowable. So.
Yeah, got it. Thank you. Our NOGA only lists 923,000, not 1.7 million. Or I would need to know, we kind of need to know what school, but
that's a follow-up for Laura.
Yeah.
That shows us that that's a NOGA where they applied for less than they were allowed, and that would be one where we would have further steps for schools that want to make use of all their funds and apply and potentially have a revised NOGA.
So cycle 2 information will be available, and I'll go back to that slide just to make sure that we can all see it, because I know some folks are better visual. So cycle 2, your information will be provided with you tomorrow. So we're providing that information by close of business end of day tomorrow. It'll have the application process and FAQ, and then your webinar for cycle 2 folks. Once again, cycle 2 folks are all private schools, whether you applied before or not, because they have to all go through the PDF piece. And then LEAs that applied last year received the NOGA, but were not paid. You applied, received the NOGA, but were not paid. All that communication will go out tomorrow, and we'll have a webinar for you, a separate one next week from 2 to 3 on September 21st on that Wednesday. So that's for those folks. Hopefully that answered the question. Marlene Grant, we had a change in leadership. We never received funding. We have been looking for a NOGA, not sure if it was emailed out. I don't see our district in cycle 3. We are on cycle 2. Got it. So we would need to just follow up separately.
Yeah, Maylene, you would just need to send us an email to the COVID case report inbox with your district name and CDN, and we can look into that for you.
Got it. If applying for the first time, okay, there we are, cycle 3, do we need to put information in the pre-award sections application? Or is the awarded application for the date we apply until March 30th? So pre-award still exists from May of 2021 up until the date of your application. But jump in there, my grants team, make sure I always like to make sure I double check. I don't know if I'm answering that question correctly. It's from an anonymous attendee, but they're asking, do we need to put information in the pre-award sections of the application? If you plan on classifying or plan on using these funds for something that you've already expended prior to you applying from May 21st, from May of 2021 to the date you apply, then yes, you would put things in the pre-award section. But if you're not doing anything till after you apply, then no, that wouldn't be classified as a pre-award.
I want to pause here for Amy or Susan to chime in, but pre-award is something you also have to put in your budget when you apply. And if you don't budget pre-award and then you do pre-award, you'll be in a state where you have to amend your grant or could be out of compliance. It's something you can address, but the ideal is to budget your pre-award for it to align to what's in your application. That will save you time through the negotiation process.
Well, feel free to jump in, Amy, or Sue. You just want to add anything? Maybe they don't. Okay, maybe we answered it well. Okay. All right, I'm looking at nonverbals. I think we're good there. How do you know if the application includes vendor testing reports? So I think that what they're asking is this. So for cycle 1 and cycle 2 folks, one of the allowables last year was you could use these funds for COVID tests. You don't have to go through the vendors. You could work with the current vendor that you were working with already locally, or if you wanted to work with someone separate or you want to hire staff to come in. If you drew down money and did that, you needed to report you still have to report all of those results from those COVID tests via a Excel spreadsheet that we sent you. It's a reporting document. The reason why is we still have to report those results to the CDC, just like if you went to the vendor side. So let me clear that up. Maybe I said too many words there. If in cycle 1 or cycle 2, you drew down money to work with outside vendors, other than the 6 that we have approved on the other side of this grant, you are responsible for reporting those results of those COVID tests that you expended money from this grant with. And there's a template. If you need that template, we can send it to you, and that is due to us. And we have a list of everyone who listed in their budget that they were doing that, and we will follow up for those results. Now, some folks change their mind. That's fine. If you did and you didn't do that, you just need to let us know, and we won't look for that from you. So we've been doing a whole reconciliation with that piece. Hopefully I answered that question. Next one, would we receive the funds prior to ordering supplies, items, or would it be a reimbursement? You want to jump in, Nick or Matt?
Yeah, that's going to be considered a reimbursement there, just because of the timeline of how that kind of shakes out. That'd be a reimbursement.
And Amy and Susan, correct me if I'm wrong, but when you're in an eGrant, technically you can draw down funds once you're approved at any time. We recommend monthly, but you're essentially requesting your funds after you've spent them in virtually all TEA grants anyway. So you won't get an advanced payment, correct, Amy? You would be approved, you'd be negotiated, and you're getting your money after the activity.
That's
which
the
is our
normal
standard.
process, yes.
Got it. Thank you for that. Are we able to reclassify new PPE items purchased for our warehouse that were closed to 1311 rather than 6? Oh, they're getting into codes now. I'm gonna rely on my
Yeah,
folks.
this is where we pretend to be account. So
Yeah.
generally from TEA, we've had this as something that is allowable. I will say, I would be ready with your documentation. This was questioned for a previous LEA. And the nature of how they inventory. I would send this question a COVID case report because we still have to clear some of this with our state health because the inventory process versus actually purchasing has been questioned and we still don't have definitive in our review. So we see it as allowable given the use of 1311, but I would ask it, and we're going to revisit this prior for cycle 3 as well to kind of highlight it. So I would be cautious. The other item here is if you don't address it in FAQ, your application doesn't really have a space to and doesn't require any narrative about inventory. This is an accounting FASRAG type of issue that we're still working with dishes on, and we've had one school we're reviewing and working with on this. So we see it as allowable, but we need to get a little more definitive for cycle 3. So please send it to COVID case report, and then we'll be able to get published guidance for you. But you have the ability to amend these applications in our standard amendment process throughout. So if your opinion of what you need to do changes or your planning changes, you will be able to amend through eGrants for any of those allowable items according to the same amendment due dates you'll see posted with the grant.
Yeah, Damon, just as we're kind of closing out here, would you
Yeah.
mind going to the grant opportunities page and kind of walking through how district would find it and kind of the resources that are posted and the documents are there just for kind of everybody's reference, and then kind of after that, kind of probably pop up the slide for like next steps for cycle 3.
Yeah. So grants opportunities page.
Yeah. So go to like the slide deck with the application. Click on that.
Got it.
Yeah. So that's going to take you to the sample app, but go to like TEA's grant opportunity page wherever.
Yeah, I have it at here. It is. It should
Yeah.
be here.
Yeah. And as you
So
know,
when
grant
you-
opportunities doesn't take you to the particular grant, so you'll have to kind of search it. So you can
I
find it
found
here.
Yeah, I found it easier by going here and just scrolling. And
Yeah.
then if you scroll a couple of times, you'll then
Yeah.
see 2022, 2023, because it's this school year, school health
Yep.
support grant, cycle 3, and then
Yeah,
it
you'll
pops
see-
up.
You'll see all of the normal stuff that we have posted in grant opportunities for other grants that we do here at the agency. It has all of the kind of the application support information. But Damon, if you'll scroll down to critical events, that's really important for y'all
Yeah.
to take note of for, the application dates, the amendment dates, and final, ER reports and whatnot as well. Just kind of be cognizant of that. Just kind of moving forward in that sample application we referred to, as well as program guidelines. If you have any kind of questions relating to allowable uses, that's all in there, and as well as contact info for us if you'll have additional additional questions, and then just general assurances and certifications and guidelines that come along with federal funds. So, and then Damon,
That's it.
I'd probably pop up that cycle 3 next step slide just to kind of do a
Yep,
brief
yep.
recap as we close it out here.
Yep. And then what I'm going to do is on our K through 12 COVID-19 School Health Support Grant COVID website, we're going to post a lot of the same documents there. So you'll be able to find it in multiple places. Let me go forward one slide. And so if you're cycle 3, as we close out today, you are an LEA that never applied during the school year 2021, 2022, you can now apply through eGrants. That's what we just showed you. Your entitlements, it's right here on this page. On our entitlements page, I go there, you can search it by LEA or ESC. You go there, your funding is listed at a $38.57 per pupil formula. You attended today's webinar, it'll be posted. I'm gonna try to get this up and posted for you all no later than by Friday, if not tomorrow. It'll be this slide deck in a PDF form and this recording. Review those documents, go to the grants page again, and then you'll hit your day. So use these resources, use everything that's posted, use it to inform if you choose. This grant is optional. You don't have to apply, but the funding is there for you if you would like it. So that's for cycle 3. Cycle 2 and cycle 1, you'll be getting separate communication from us. Cycle 2, you'll get it tomorrow by close of business. And cycle 1, you'll get it by September 26th. Thank you all so much. If you have any further questions, please reach out to COVID Case Report. I know we couldn't get to all the questions, but thank you all. We'll officially go ahead and shut it down. Thank you all. Thank you, Nick, Amy, Susan, and Matt for being the grants experts that you are. Thank you all. Have a great one.